Welcome to the Transformative Neurotherapy Podcast with your host, Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. This is the place where healing happens faster. Because let's face it, your brain doesn't come with an owner's manual until now. Here, we take a holistic approach to brain health, bringing together science, mind-body harmony, and the tools you need to optimize your well-being. Whether you're a high performer, executive, athlete, longevity hacker, or just someone tired of your brain working against you, Dr. Putney is here to help you unlock your full potential. From brain fog to chronic stress, we're covering it all so you can finally experience brain health, mind harmony, and total well-being. Ready to get unstuck? Let's get started.
Addiction recovery isn't just behavioral, it's neurological. Dr. Putney explains how neurotherapy supports healing by rewiring the brain stress and reward systems. Welcome, everyone. I'm Julie Schwenzer, co-host and producer in the studio with Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. Dr. Heather, thank you again for being here. Let's talk about addiction. How does neurotherapy support recovery?
Yes, neurotherapy it's amazing to help people with addictions, both behavioral and substance addictions, to help the healing process. One of the reasons I got into this as well, I think I mentioned a little bit in the last episode, but I do work with a large clientele with behavioral addiction, specifically sex addiction. In my practice. So I do a lot with clients with sex addiction as well as, their partners in different ways. But it's interesting. Anybody that struggles with addiction, a lot of times they can struggle with addictions in multiple arenas. So they might struggle with sex addiction and alcohol and workaholism and other things. And so they just tend to be kind of more addictively wired brain. And, one of the other things that I noticed with my clientele that caused me to get into this is that the addicts that I was working with that I felt were really doing good recovery. They were following the things they were supposed to be doing, attending the 12-step groups, doing the correct work with therapy, and still struggling with long-term sobriety. It felt like they were a little brain stuck. I was kind of at a loss because I really felt that they were being genuine in their attempts, but they just couldn't heal. And one of the things that I found as I looked deeper at that subset of the clients is those clients actually had ADHD in addition to addiction. And so when you layered that addictive piece plus the ADHD piece, it was much harder for them to get sober than my other clients. So when you add that impulsivity in addition to that tendency, it was kind of a double whammy. And so those clients needed additional support to try to help them heal and to actually get to long-term sobriety. And our last podcast focused on how neurotherapy helps ADHD. So someone interested in this can kind of get a little bit more insight into that. But there is kind of an overlap in the profiles in the brain with addiction and ADHD. And so we can kind of treat those similarly.
And then like you're mentioning too in the last podcast, what you do you work with other providers to also help with ADHD. What other treatments complement what you do with neurotherapy when it comes to, addiction and are using medication assisted therapy, or do they come in and they're already on it? And, how do you work with that?
Those are great questions. I tend to work more specifically with people with behavioral addictions. They might lean a little too heavy on marijuana or a little too heavy on alcohol, but they're not reaching the more severe level of addiction in those areas, because I'm not CAADC trained, which is a person that is a therapist that specializes in substance abuse and addictions. And so if somebody comes in and they are reaching that level, then they need to go inpatient to help do this work. Fortunately, one of the reasons I know so much about how neurotherapy helps addiction is that Nicholas Dodris, who's also the founder of Neurofield Neurotherapy and the innovator for a lot of this stuff, actually also works at an inpatient substance addiction treatment center, and he works heavily with this population. So what I speak to that's not behavioral addiction is actually going to be things that I've learned from him, about how this helps clients heal. And he uses it, and I wish I could, and I'm going to actually maybe invite him to the podcast one day, but because I can't present his data. But what they have found is that, like I said, it's a multiple addictions inpatient clinic. As what they've found is that, they'll come in and they will get their PHQ-9 and their GAD-7 scores. So that's basically your depression and anxiety scores, and when they start and when they add neurotherapy treatments, so they basically tested clients where they had, and this is a wonderful facility he works at, and they did clients that chose to do neurotherapy plus all the other great stuff, talk therapy, maybe EMDR, and all the other good stuff that group therapy that you do on an inpatient setting. And I need to reiterate, if clients are medically detoxing, they need to be inpatient. We can maybe help people when they get out, as far as and that piece is being managed by somebody that has the right treatment. So if you're dealing with, like I said, chemical substance abuse, you want to go inpatient with someplace where they can help you detox and heal. But what they noticed is as they had some controls, people that chose to do neurotherapy and those that didn't, and they had different types of primary addictions, whether it be alcohol, benzos, opiates, amphetamines, right? And they got their depression and anxiety scores before, and then, after so many treatments. And then they compared it to the controls. Now, the controls did improve with treatment at the facility, but the difference between the groups that did neurotherapy and the controls was just massively different. In every subset group, alcohol, benzos, amphetamines, all that type of stuff, they all improved, and they all improved statistically significantly amounts when they added the neurotherapy. And the other cool thing is they tended to stay in treatment longer. One of the reasons why is that the neurotherapy treatments that they utilize can help reduce cravings, can help reduce some of those jitters, and it can make the detox easier, so that they're able to kind of then if you're not so physiologically overaroused or in so much pain, because when you're detoxing from an opioid or from some of these other medications, like you tend to feel a little bit like a raw nerve. You tend to feel really painful. Well, when I'm in pain, how much can I think about other things? How much can I let in this amazing therapy, even if the best therapists in the world are there, if I'm so physiologically distressed? But the neurotherapy can help balance the autonomic nervous system. We talked about this parasympathetic, sympathetic things with, vagus nerve stimulation. We can also kind of help with the pain, the pain and reward systems in the brain. Sometimes that inability to tune out pain kind of gets locked off. So then the pain is kind of ever present, but that ability to tune in and tune out from the pain, we can kind of strengthen some of those centers in that switch so that they can, start to feel more normal. And then, like I said, once they get a little bit more physiologically more centered, then they can let in all these other things. And so that these clients that engaged in neurotherapy tend to stay in treatment longer than the ones that didn't. And then they also tended to have less recidivism, which is they're less likely to bounce back into therapy later, because they just go out, they get, they slip back into old habits and bounce back in. They're actually more regulated, their brains are more calm and so forth. And so they don't have that same driver behind them that makes them want to use in the same way. So.
Okay. Thank you for explaining that. The last question I have for you is, what would you say to someone who's skeptical about this, the brain-based approach? Because maybe they have, like you mentioned, they've been on different medications, or they try different things, or they're afraid they're going to relapse. What would you say to them?
I guess I see what's the harm in giving it a try, because what you're putting in your body, what you're doing to your body is so much worse than what we could be doing, calming your nervous system, giving it a little bit of extra blood flow, this, that, and the other. I say try it. I mean, it's definitely a lot less dangerous or a lot less whatever. And the proof is in the pudding. A lot of these clients are so overaroused they can't sleep. So one treatment in and they're sleeping better, or they can notice a general shift. So what do you got to lose? You really have nothing to lose. Try it and see for yourself. Proof is in the pudding.
That's true. And, your last, the client that was on 2 podcasts ago, she was just talking about how much better she was sleeping, who was your patient. So that's proof right there.
Absolutely.
Well, thank you, Dr. Heather, for sharing that insight. We always appreciate it. And we'll catch you next time.
Thank you.
You've been listening to the Transformative Neurotherapy Podcast with Dr. Heather Putney. Remember, your brain isn't supposed to hold you back. It's supposed to power you forward. So stop letting it crash your party and start letting it do its job. If you're ready to optimize brain health, sharpen your focus, and age like a fine wine, schedule your free consultation today at transformativeneurotherapy.org or call us at 412-204-7397. Because here, healing happens faster. See you next time.